Alport syndrome. So, good pastures. Good pasture, you need to know that it is an autoimmune disease. So, here the autoimmune antibodies are directed against type 4 collagen, which is present of the of glomerular basement membrane. Fine. So, you need to know that this type 4 collagen is present in many places. So, one of it is kidney. Other than that, it is also present in lungs. It is also present in eyes, ears, skin, as well as the blood vessels. So, here the antibodies are directed against this type 4 collagen of the kidneys as well as the lungs. Therefore, the patient will present with hematuria and the patient will also present with hemoptysis. You should also know that this will present as bright green in immunofluorescence. That is another important aspect which they might ask you in your assembly. So, you should know that. A disease almost similar to good pastures is Alport syndrome. So, what happens in Alport syndrome? Here also the defect is present in the glomerular type 4 collagen of glomerular basement membrane, but this is an X-linked recessive. Some books state it differently, so just make sure to recheck this what your book states. So, from what I have learnt, this Alport syndrome is a genetic mutation, is an X-linked recessive. So, there is no autoantibodies. Fine. So, there is a mutation in this X-linked recessive such that the basement membrane is problematic, and especially the type 4 collagen of the basement membrane. So, as I had already told you, the type 4 collagen is present in many places, right? So, here in this X-linked recessive disease, not only in the kidneys, the type 4 collagen that are present in the eyes as well as the ears are also affected. So, in eyes it will result in a cataract and a blurry vision, and it will also present with sensorineural hearing loss patient. So, you need to know that in Alport syndrome there will be splitting of lamina densa. So, what is lamina densa is? Lamina densa is nothing but it is a layer of the basement membrane. Fine. So, this is the basement membrane which I had already told you. This basement membrane will have 3 layers. One is lamina densa, and the innermost layer is known as the lamina interna, outermost layer is known as the lamina externa. This lamina densa is problematic, isn't it? So, therefore, there will be a splitting of this lamina densa such that it forms 2 layers. That's what it gets split. Fine. So, this is known as the tram track appearance, the splitting, because it looks like a tram track, isn't it? So, this basement membrane I have just elaborated it and I have drawn it. So, this is what happens in the Alport syndrome. The basement membrane is split into 2 and it has a tram track appearance. Thank you for listening. Have a good day.